My name is Derek Robertson, and I'm the parent of 3 sons, 2 of whom have sickle cell disease. And sometime back in around 2006, my wife and I, Shantae, formed the Maryland Sickle Cell Disease Association to help raise awareness and have advocacy around sickle cell disease. My wife has a word she likes to use to describe sickle cell disease, and that is unpredictable. And it really is. So sickle cell disease has impacted every aspect of our lives. And that goes from when you're trying to plan a vacation. I remember when our sons were younger, just in terms of what you take with you. Our youngest son also has asthma, which is, is a comorbidity with sickle cell disease, and you have to pack the inhaler and the nebulizer and everything else just going into, and I would watch some of my friends, when they're going somewhere, they just pick up and leave. So as they got older, where are they going to go to college? What's healthcare like? So there are just so many things. Sickle cell is just front and center.
In sickle cell disease?
Specifically, the treatments for pain for sickle cell disease, well, not counting the drugs that have just recently come out in really the last two years, but before that, there really is no specific drug to deal with the pain. So one of the most frustrating things about sickle cell disease was when our son was in the hospital in excruciating pain. It was just very frustrating that the only thing that the doctors would talk about is the dose of the medicine. Do we do more morphine or less morphine? Do we do, what do you do? There really was nothing to treat the pain. Mm-hmm. So there's no treatment for the pain. It's just how do we try to lessen that pain? So one of the things about sickle cell disease in terms of how many crises happen in a year, our sons are very, very different in terms of, although they both have the same disease. And that, I think, is typical of sickle cell, right? It just varies so much. So our middle son has really only had one crisis that ended up in the hospital. Our youngest son, he used to have up to 4 to 5 crises a year. But I should point out that our sons have sickle beta thalassemia, which is sickle beta thalassemia plus, which theoretically is the mildest form of the disease. But even with that mild form, our youngest son presented much more like an SS patient. Mm-hmm. How many do we manage at home versus going to the hospital? It's hard to tell because as our son got older, he would complain of being in pain, but he didn't want to go into the hospital. So I would say it would be a really small percentage that we actually go to the hospital, because he learned to do one of two things: either just tolerate it, go to school because he didn't want to miss school, or take pain medicine at home, and then eventually go to the hospital. He didn't like it. You have to go through the emergency room, and as a pediatric patient, that really wasn't that bad. Honestly, because we would call ahead, and our hospital had a protocol with the emergency room. So we wouldn't stay too long before at least we got taken back. But it would mean that he would miss everything. He a very good sports player. So he would miss school, he would miss sports, he would miss his friends. Nobody wants to do that. And then it's just when you're at home and you have your family and you're in your own bed, that's, I think, what he just preferred to do.
Yeah.
Hope is you talk about hope and new medicine. I think hope is an excellent word. I mentioned before when our son was in the hospital and not being able to do anything other than talk about pain medicine. Now we have hope that we can actually have medicines that are going to treat the disease. That is immeasurable, because you want to be able to have options. You want to be able to give something that you just want your child to be better. You want them to feel better. And you want to know that what you're giving them is not just a band-aid. It's not just a stopgap until the next time. But here is a medicine that can actually change what the disease is doing, so for the better. So we're just very excited. And we recognize that not all the medicines may work for our son. And that's why we continue to need more, because it may not work for our son. So I mentioned now he is only having, he hasn't had a crisis like once a year or so. So the new one of the new drugs that is out there is going to be a monthly infusion to prevent, vaso-occlusive crises. Well, he may not be a candidate for that drug because he's not getting that many crises. But it's a candidate. You have a lot of people who are. And for us, that means that maybe the next one will be for him. And so I just think hope is a very appropriate word. That's what we have. We have that now.